We have arrived at our final topic for the lecture portion of our microbiology course, and it's going to be disorders associated with the immune system. Now, when you hear disorders of the immune system, you might think first about autoimmune disease, maybe HIV/AIDS, maybe allergies, but we're going to start with something that might be surprising to you, and that is dysbiosis. As you know, we have a normal microbiota, and that mix of bacteria is actually protecting us, and it's helping our immune system in a variety of different ways. So when there is an imbalance in this normal microbiota, then you have definitely adverse effects in humans. And one of those adverse effects is clearly a cluster of diseases that are known as IBD, or inflammatory bowel diseases. So a couple of things here that come to mind. One way of having such an imbalance in this normal microbiota would be that you take a round of antibiotics and it kills your normal microbiota, and then you have an opportunistic pathogen such as C. diff that will proliferate and cause problems. So here, Clostridium difficile is a common hospital-acquired or nosocomial infection, and it is usually the result of antibiotic use, and a lot of times people acquire it in the hospital. Other diseases that are sort of belong to this cluster of inflammatory bowel disease problems is Crohn's disease, and then also ulcerative colitis. So these are all related to imbalances in your normal human microbiota, and they can cause problems with your gastrointestinal tract. Here you have side by side what an endoscope view of a healthy, normal, large intestinal colon should look like. And over here, you can see definitely the inflammation and pus even going on. This is inflamed, ulcerated kind of colon right here. You can see the ulcerated regions. And that is somebody with Crohn's disease right here. You might imagine that this is not going to be nice to have. You're going to have cramps, you're going to have probably diarrhea. It's definitely abdominal pain. Now, in recent years, there's a new therapy that has really gained some traction, even though the pharmaceutical industry doesn't really like it that much because it is cheap and very effective. But fecal transplants, in other words, poop transplants, they are highly effective in treating people that have imbalances in their microbiome. And so basically, you're taking the microbiota from a healthy individual with some good mix of bacteria, and you're transplanting this fecal transplant into a new patient. Best way to do it would be suppository, so directly putting it right where it needs to be. And it might sound disgusting to you, but it's a very effective and not very expensive way of treating somebody with inflammatory bowel disorder. Here's another option listed here to treat Crohn's disease with worms. I don't want to say too much about it, but recently this fecal transplant method has been very successful and widely used. I'm not sure how many doctors would treat Crohn's disease with worms, these whipworms. There's a picture showing you what that might look like, treating somebody's Crohn's disease with whipworms. So you have these whipworms here in a capsule, and I'm assuming that the material that the capsule is made out of is to circumvent the stomach acidity, and then it will dissolve once it's in the small intestine. And here you have the whipworm. I'm not sure who would want this kind of therapy when you can have a poop transplant. Neither one of them sound very appealing at first, but the poop transplant is actually the way to go, and it's been very successful and has helped many people. Now we're moving on to another problem that often occurs with the immune system, and that's allergies. And I think most of you can relate to that. There are many people that have allergies. Basically, an allergy is an overreaction of your immune system. It's fighting something that isn't dangerous at all. It's not a pathogen. It's just something that triggers an immune response that shouldn't be there. So basically, it's a hypersensitivity. You're sensitive towards something that is not dangerous, that you shouldn't be sensitive to. And so it's an antigenic response beyond the normal. So it's an overreaction of your immune system. It occurs when you're sensitized by a previous exposure to this allergen that your immune system perceives as an antigen and starts to react against. So there are 4 types of hypersensitivity. The worst one would be the anaphylaxis, and that's a body-wide release of histamine that can lead to shock and is very dangerous. Cytotoxic hypersensitivity, then the immune complex hypersensitivity, and delayed cell-mediated hypersensitivity. So I'm going to go over those 4 types of hypersensitivities in just a minute, but let me say something about this last bullet point right here. Hygiene hypothesis suggesting that if you're limiting exposure to pathogens, you may end up with a lowered immune tolerance, and that might lead to more allergies. And the idea here is that if you are the person that's constantly after somebody with the hand sanitizer, making sure that your kids are constantly washing their hands, which, by the way, right now is a good idea, but in general, if kids are not really exposed to a variety of potential antigens, then the immune system doesn't really learn how to distinguish stuff that's dangerous from stuff that maybe not so dangerous. And so it's been shown that kids that are growing up in very dirty kind of settings, where they're exposed to lots and lots of different allergens and antigens, that they have stronger and healthier immune systems than people that are growing up in very sanitized, kind of more sterile environments. So there were studies of kids growing up in these farm settings with exposure to lots of antigens, and they ended up having stronger immune systems and fewer allergic problems as opposed to kids that were growing up in these very clean, sanitized kind of environments. But anyway, let's move on with the types of hypersensitivities. So here we're starting out with type 1, this anaphylactic. This one is potentially very dangerous, even life-threatening, and because it can lead to shock. And then it's called anaphylactic shock because you have a body-wide release of histamine, and that can lower your blood pressure, and then you go into shock. The problem with anaphylaxis is this massive body-wide histamine release, and it leads to a massive drop in blood pressure that could be potentially fatal. People, most of the time, so anaphylaxis, you have that when you have massive allergies to like insect venom, for example, or it could be also drug injections that can cause anaphylaxis. Moving on to type 2, cytotoxic hypersensitivity. There you have, first of all, you have more time, and also here the problem is the complement activation, and then the complement will destroy target cells. This is a lot of times happens with transfusion reactions or resource incompatibility. Then we have type 3, that would be the immune complex type of hypersensitivity. Also has more time here, 3 to 8 hours. And in this case, antibodies and antigens form complexes that cause damaging inflammation. And this would be like serum sickness, for example. And then the type 4, the delayed cell-mediated or delayed hypersensitivity, that one is also fairly quick, so 24 to 48 hours. And there you have antigens that activate cytotoxic T cells, and then they kill the target cells. And that's a lot of times transplant rejection that can happen, and contact dermatitis, poison ivy, those kind of things. Here's some more information about the different types of hypersensitivity reactions. So let's start again with the type 1, the anaphylactic reactions. They're very fast. That the antigen in this case will combine with IgE antibodies, and it leads to the degranulation of mast cells, basophils, and the main substance that's in these basophils and mast cells is histamine. That's what's in these granules. So once the degranulation happens, then you have body-wide release of histamine. You could also have leukotrienes and prostaglandins. And that leads to increased permeability of blood capillaries. So it means you are going to have increased blood flow. It's like body-wide inflammation, basically. And so you have more blood flow going to the peripheral areas of your body, and that can lead to a drop in blood pressure that can put you into shock, and that would be then an anaphylactic shock. So here, mechanism of anaphylaxis, it leads to degranulation, so these granules from the mast cell basophil coming out, and so the granules shown right here, and they release their content, and so that's mostly histamine and then also other mediators. So worst case scenario of systemic anaphylaxis, this is an anaphylactic shock, where a lot of times then people, they have this massive drop in blood pressure due to the histamine release, and then that leads to circulatory collapse, and you could die. You can treat this with an EpiPen, and that's what people that know that have massive allergic reactions, so let's say bee stings, and they have to carry an EpiPen, because that's the only way you're going to be able to save your blood pressure to the point where you don't have the circulatory collapse. And so the EpiPen will then counteract the effect of the histamine and will keep your blood pressure in normal levels. Localized anaphylaxis, well, of course, it's not as bad because it's localized. And so that's usually in conjunction with ingested, so you've eaten or inhaled antigens. And the symptoms, they depend on whatever you've inhaled. Either you've eaten something or inhaled something, so it could be then hives, or hay fever, or asthma. So here would be localized anaphylaxis caused by pollen grains, and then here somebody's allergic to a dust mite or house mites. These little animals, they can cause allergic reactions. So it'd be more localized anaphylaxis. Here's how you can prevent anaphylactic reactions. It's usually that you are undergoing desensitization. So that means you continuously exposing your body, your immune system, to the problem, and eventually your immune system learns to deal with it and not overreact to this all the time. So eventually you will produce IgGs, which act as a blocking antibody to intercept and sort of neutralize the antigens. Here is a skin test that's done to identify the allergens, the stuff that somebody's allergic to. So there's usually whole panels that are people then exposed to, and they're looking for these allergic reactions, these local inflammatory reactions, to see what you are allergic to, and then they will treat you with a lot of times just desensitization. Here's some more information about type 2 cytotoxic hypersensitivity reactions, and that would be involving the activation of complement by the combination of IgG or IgM antibodies with the antigenic cell. It causes lysis or damage that's done by macrophages, and a good example for that would be the ABO blood group system. Form antibodies against certain carbohydrate antigens on red blood cells, and that would be, for example, the A or the B antigens or both, and this is just an example of type 2 cytotoxic reactions. So here are the ABO blood group system, and there we have if you're type A blood, then you have the A antigen, and you might make plasma antibodies against B, so then you have anti-B plasma antibodies. If you're blood type B, then you have the B antigen on your red blood cells, so that's self, and then you might make the anti-A antibodies. If you are AB, then you recognize both A and B antigens as self, and you should make neither A nor B antibodies. If you're blood type O, you have neither one of those two antigens, and you might make antibodies against A and B, so anti-A, anti-B antibodies. Here's another example for type 2 cytotoxic hypersensitivity reactions involving the Rh factor or Rh antigen. It's found on 85% of people's blood, so 85% of the population is Rh positive, has that antigen. The problem comes in when you have an Rh negative mother and she carries an Rh positive baby. So Rh positive is that's dominant. And so if the father is Rh positive, chances are that the baby is going to be Rh positive. And so if the Rh negative mother is exposed to that blood, then she will make antibodies, and that can lead to hemolytic disease of the new